Ladies and gentlemen, welcome aboard the Pilot Lawyer Podcast. Thank you for your attention while this important legal information is reviewed. What you hear should not replace consultation with an attorney and should not be considered advice for your situation. On behalf of the Pilot Lawyer and your entire crew, it's our pleasure to have you aboard.
Welcome, aviators, to the Pilot Lawyer Podcast. With us, the Ison Brothers at the Ison Law Firm. You're here with us as we navigate the FAA medical certification process for pilots and those who want to become pilots. In this podcast, we loosen our ties a little and try to have a good time with an oftentimes frustrating subject. We say around the office, if you don't laugh, you cry. So whether you're laughing at us or with us, join us brothers as we discuss the fascinating world of FAA medical certification. You know what, Alex? I'm tired of hearing you talk all the time.
Hey, you know what? I'm back for this one, okay?
Yeah,
I was out on the last one, dealing with the kids and all that good stuff.
Yeah, saying all sorts of stuff behind your back. So.
I know, I heard.
So, well, that being said, I would like to hear someone else's voice for a change. So today we're going to have Matt McNeil from Lift Effect on the podcast. He's going to be a guest. Yeah. And so Lift Effect has been working with professional pilots, airlines, flight departments, pilot unions, and pilot assistance programs throughout the world since 2007. Established by commercial airline pilot, mental health professional, and mental skills coach Matt McNeil, who's going to be on the podcast today, Lift Effect specializes in helping professional pilots with depression, anxiety, acute chronic stress, complex trauma, mental performance issues, as well as alcohol and drug dependency and abuse concerns.
He's going to have some tough nuts to crack here today, I imagine.
Getting into our psyche will be the jewel in the crown of his career.
Yes.
Lift Effect is the industry leader in assisting professional pilots with mental health and mental performance-related concerns. They understand the challenges of operating in the environment because they've operated in your environment before.
And I think that's really important to have somebody who knows the process, kind of walking you through it and helping you, especially in a tough time like that.
That's absolutely the case.
That's why I
very
said
good. Very good. Well, let's see if Matt catches his caller ID and sees it's us calling and see if he answers or not. And
we're using the scam number this time.
Yeah, that'll get him.
Yeah.
Let's see if he answers.
Anthony.
Hey, Matt, how you doing?
I'm awesome.
That's great.
How are you?
I'm doing well. Hey, I was afraid maybe you wouldn't answer, so I'm glad.
No, I always answer when you call.
Yeah.
You're the first.
although an attorney, usually you try not to answer when the attorney calls.
Yeah, the meter usually starts when your attorney calls.
We don't like to think of ourselves as attorneys.
Yeah, we're just
anti-attorneys.
Yeah.
Well, pilot attorney is just a whole different thing.
Yeah.
More like bumbling idiots that accurate. Know a thing or two.
I can relate.
Well, hey, man. Well,
what's going on?
Yeah, well, thanks for being on the podcast. We thought we'd class it up a little bit around here and have someone on that knows what you're talking about. So, so we thought, I'm sure everybody knows you, but I thought maybe you could just kind of introduce yourself and give us a rundown on what you do, where you do it, how you do it, that type of thing.
Totally. Well, Matt McNeil, I'm the founder and now my title is the Director of Human Performance at Lift Effect. I used to be the clinical director, but I've since passed that torch on to somebody else. Basically, what we do at Lift Effect is we work with professional pilots that are having mental health or mental performance related issues. And so as the Director of Human Performance, I oversee the coaching side of the house, which is the mental performance related stuff. So check ride-itis or, training failures that are really due to just sort of mismanagement of mental skills. And then I oversee the clinical side of the house, which is what we provide is psychotherapy to professional pilots. We do not prescribe medication. We're not psychiatrists. But we're licensed professional clinical mental health counselors, either master's or PhD level. And then on the coaching side, all of our coaches are International Coaching Federation certified coaches and professional pilots, flight instructors, CFI, II, MEI. Most of our clients, probably 95% of our clients are airline pilots. but we do some GA pilots, and we do a lot of pilots that are in training. We work with CAE, which is a company. We provide all of their instructors and all of their students with a pilot dedicated assistance program to help them with those kinds of issues.
Nice. Okay.
So that's what we do. Pretty busy.
Yeah.
Pretty busy over here.
Yeah. I just fact checked all that on your website. That was accurate.
There you go, man.
Yeah. Well, that's good. Well, that's good. Well, we know you do good work. We work with you a lot. And so, we kind of know the answers to a lot of the questions we're going to ask you.
Well, you do. I know.
Yeah. Chris and Alex.
Yeah, I'm hearing all this for the first time.
Right.
All right. Well, first timer, man.
Yeah.
What's a burning question for you?
Well,
you don't want to know what that question is.
We don't want to get into that psyche. Yeah, you want to get into that.
Yeah.
You have to charge us for that.
Are we doing therapy or coaching, guys? What are we doing?
Definitely therapy.
All right, let's do it.
Well, so you kind of touched on this, but like, let's say someone comes to you for the psychotherapy or comes to Lift Effect. What kind of conditions you're working through there? And then, and I think you said, it's mostly for airline pilots, but you do general aviation pilots too, I'm sure. So walk us through kind of what you look at on the spectrum there.
Well, it's kind of most pilots, for a pilot, and now it's changing. The landscape has changing, and actually, in large part to a lot of the work that you guys have done with pilots by representing them. But it's culturally, I think we're seeing a shift with pilots and mental health. But initially, when I got started in this, you couldn't say the word pilot and mental health in the same sentence.
Yeah.
It's just like, not happening. So when I initially started doing this, by the time a pilot would reach out to me, and it started with me just as a private practitioner. I was an airline pilot myself. Between furloughs, I'd always just go get degrees.
Sure.
And so, it's like I get a backup. But I started treating pilots very, very underground. They would come to me because they were like, well, this dude's a pilot and, I feel kind of more comfortable. But by the time people would get to me, they were in pretty bad shape. I mean, for a pilot to reach out and say, I want to get therapy, they're kind of like, I used to say they're bleeding out on the side of the road and they got nowhere else to go.
Sure.
By that point, that's changed. I think there's a lot more proactive, especially generationally, like the Gen Z kids and I'm a Gen Xer. We're kind of like, just do it yourself.
Yeah.
The millennials are a little more hip to like, they've seen, a lot of them grew up with, their parents who had therapists. Some of them had therapists. So it wasn't this sort of dirty word. So they're a little bit more apt to reach out. But it used to be pretty acute, kind of things. And we still see a lot of that. But most of the issues are anxiety. I would say that's probably 80% of the problems are just anxiety related issues. And then the other 20% fall into the depression, substance abuse. We don't do a whole lot of substance abuse stuff because the FAA has their HIMSS type program,
right? And
it's so regimented and regulated that we don't really do some of that. There's kind of a protocol for that, but it's more depression, anxiety, OCD, ADHD kind of related.
Sure.
Types of issues.
That's fair. Yeah.
On the clinical side.
Yeah. That's fair. I think early on in our practice, with mental health issues, it was more so, hey, we're going to have to disprove that this ever happened and there's no problem. But now it's kind of segued into, okay, we can acknowledge that it happened and, we're mitigating the risk through X, Y, and Z. A lot of times that's therapy. And so sometimes we'll see the FAA asking the airmen to approach therapy and do some other things, maybe see a HIMSS AME, which used to be, as you well know, mostly just for either SSRI cases or substance use cases. Now it's like, if somebody has a potential concern for recurrent depression, we're going to have them see a HIMSS AME, we'll have them do psychotherapy and then have a follow-up evaluation with a HIMSS psychiatrist every year, something like that. So it is definitely sort of evolving on the FAA side. Which is good for you. I think good for the airmen as well, because now people are a little bit more apt to get the help they need, and they've got good folks like you out there that they can help. So let me back up. Let me back up to say, so you're in Denver, right? But you see people kind of all over the country. Is that
all over the country? I'm in Denver. I've got clinicians one's in Minneapolis. I've got, clinicians, and a lot of us are licensed in many states as well.
Good.
So we've got way too many licenses, to be honest with you.
Sure.
I have to have somebody full time that just kind of manages all that stuff.
Yeah, that's
for
good.
me. But yeah, we're telehealth, and the reality is during COVID was amazing because they opened up they dropped the state requirement.
Mm-hmm.
And just said you could treat anybody anywhere, and it worked great, and it was fantastic. People had greater access to care, and to show you the intelligence of the AMA, they just were like, well, okay, COVID's over now. It's no longer safe or good to do,
Right. Yeah.
which is just it's like it's nothing more than to make money
Sure.
off of clinicians. It's preposterously stupid, but
Yeah.
we try to strategically get as much coverage where most pilots live, and that kind of covers most of it. But the reality is pilots are traveling a lot. They're all over the world. They're all over the country. And so most of what we do is telehealth. Every one of us has an office if people want to come in. But since COVID, it's like less than 1% of people want to be treated in the office. Everybody wants to do telehealth, which is great.
Sure. Yeah.
And so it just gives people greater access.
That is good. And speaking of COVID, in our practice, we're still seeing the trickle down of individuals who've had COVID-related mental health issues that. And so that's been a big thing for pilots, and still is. People that were treated during COVID, or maybe had drank more than they like during lockdowns and so on. So definitely see a lot of that. And that's, again, I think kind of where we're seeing, from my understanding from sources, that we're seeing sort of this explosion of the mental health issue with the FAA. And so it's definitely good that folks, like I said, are out there like you. And so let me ask you this, and just because if you can keep up with me being all over the place here.
Yeah, of course.
Yeah.
Go for it.
So what do you perceive? Now, some people, just feel like, I've talked to a share of people lately that, they've had some mental health concern. They are, they were sure that they would never get a medical certificate. Are there things though that you perceive in your practice that are like, hey, that this is going to be pretty tough mental health wise?
Yeah, that's a really good question. I mean, what we see is if you have a permanently disqualifying mental health issue, and those, as you guys know, like bipolar disorder, any sort of psychosis or a personality disorder, if you indeed have that,
right,
and so a lot of it's there's a lot of misdiagnosis, especially with bipolar.
Mm-hmm.
I mean, that was like a big popular thing, 15 years ago. It's like everybody had a bipolar diagnosis. You go to the emergency room and everybody walks out with a bipolar 2 disorder, which is just like really, really stupid.
Right.
And ADHD. That was like everybody had ADHD as kids.
Yeah.
And then the reality is like they don't have ADHD. But if you indeed have one of those disorders, that is kind of a game ender.
Sure.
But a lot of times it's like, well, do you have the disorder?
Mm-hmm.
And so we've done a lot of work around, if it's very questionable, it's like, well, let's see if we can maybe reassess if this is actually, if that diagnosis is accurate.
Sure.
So that's a whole thing. But then if people have depression or anxiety, we get all of those people back to work.
Yeah.
Because it really is, and I tell people, like, this is not a career ender. You have to make sure that this condition goes into remission, that you're getting properly treated, which is what we do. We try to do at least the psychotherapy piece. You've got all these medications now. Mm-hmm. They've significantly increased the list of medications, thank God.
Right.
Instead of staying with the same four, which is like the oldest, the oldest medications around. It's like, so if you can get the proper, medication management, make sure you get the psychotherapy, let's get this thing under control. And then we can work through the process of getting back, and we get everybody back to work. That does the work themselves. They show up, they do the work. We get the return to work process. We have a very, we've learned a lot of lessons over the years of what works and what does not work. And we find that the FAA is not really, is not really the enemy that they used to be. If you've got something if it can get into remission and we can get under control, there's a path back.
Yeah.
But you just got to make sure that you're getting treatment and not trying to kind of brush this thing under the rug and never really getting it under control.
Yeah. I mean,
so I don't know. Did that kind of answer your question?
Yeah, absolutely. I think it does. I mean, if you're going to sniff out in your process, whether this is realistic or not, if somebody has, one of these significantly or specifically disqualifying conditions. And then the beautiful thing is, and I think this is counterintuitive to individuals that are trying to get a medical certificate. Their perception is, hey, well, if I get therapy, I'm screwed. I'm not going to, they're going to see that I'm in therapy, and that's not the case. Even in a case like where somebody has a history of bipolar that we're trying to maybe discredit for the FAA, the piece of having the therapy and having the evidence of ongoing stability is good evidence for us to be able to say, hey, listen, FAA, this airman's got 6 months of, good therapy with Matt or, anybody at Lift Effect or elsewhere. And then, that shows that stability that we can build on from there. So I think that's definitely an encouraging piece. Now, somebody who's myself, I've not had therapy. I've been told that I could use it quite. So tell us, for the folks that might be spooked about, hey, I don't want to go talk to somebody about my feelings.
Yes.
What happens in a therapy session? I know that's probably a dumb question, but.
I don't think it's a dumb question at all. Like, it's not like, I think a lot of people have this idea of therapy is that you're laying on a couch with some dude with a clipboard sitting behind you, just kind of, take like you saying stuff and then he's like writing notes down.
Sure.
Right?
I'm sure there's a form of that. Somewhere they're doing that.
That happened in the 1800s, right? Yeah. But like that is not, like what therapy is. Therapy is first and foremost, it's a relationship that's established between the therapist and the client. Mm-hmm. It's a relationship. It's two people coming together and trying to understand each other and putting their heads together to saying, look, I mean, I tell everybody this. I say, listen, I am not, if you came to me and I was like, all right, Anthony, let's do some therapy. First thing I would tell you is like, I am not the expert on you and I will never be the expert on you. Sure. Right. And anybody that says they're an expert on you, run because they're full of crap. You know you better than anybody. And I will never know you better than you know yourself, period. I don't care if you're depressed, you're anxious or whatever.
Sure.
But here's what it is. I have the vantage point. You're standing on one mountain. I'm standing on the other mountain. I can see some different pathways to get up or down that you can't see because you're standing right on top of it.
Sure.
And I have training and a lot of experience in being able to look at the landscape and say, hey, what about this? Or maybe you should think about, heading over here based on what your goals are and what you're trying to work on. Maybe that will help.
Sure.
And, and that's the advantage of what a therapist does. I mean, I tell people I smell breath for a living, right? Because nobody can smell their own breath. Yeah. And sometimes I'll say, hey, that smells pretty good. Or I'll be like, that kind of stinks. Yeah. Maybe you might want to try something else here. And that's really what therapy is. It's not this mysterious place where, I know more about you and I'm judging you. It's me trying to understand your situation and being able to say, hey, here's maybe some different ways of looking at this or approaching this that might help you move the needle in a direction that's based on what you want to get out of it.
Has your FAA medical certificate been denied? Are you concerned you may not be able to get a medical certificate from the FAA? Are you at risk for FAA action for failing to report your medical history appropriately? Call the pilot lawyer at 1-855-FAA-1215 to discuss your options for getting the FAA to issue your medical certificate and get you flying. We are happy to evaluate your case and discuss with you a plan for presenting your case to the AME or the FAA. Aviation law is all we do, nothing else.
And then I think that segues into the next thought here is, some people that I've encountered are concerned with how long are they going to be in therapy? Is this something I'll be doing for the rest of my life? And what does that typically look like? I mean, I'm sure that's case dependent.
Totally. Yeah. I mean, I can tell you, our goal is not to keep you forever. It's to help you figure out what are your objectives, what do you want to work on. Let's give you some tools so that you don't need me. You can do this. I mean, therapy happens between the sessions. It's not what happens during the session. It's what happens between. So, and it really depends on the orientation of the therapist, what kind of modalities they use. But I don't, at Lift Effect, we don't like to stand around and admire problems.
Sure.
It's not construction work, one guy digging and 5 guys watching.
Right.
I mean, it's let's figure out how to give you some tools so that, you may not need us as much, or maybe you just check in every once in a while just to kind of bounce some ideas. So, but it's individual. There is no formula for it. It's person specific. But I would say, the way that we work, within 3 sessions, you're going to have a pretty good idea of at least what the work looks like. And then based on that and based where you're at, we can determine what kind of, what's the frequency and what's the duration.
Sure.
But, if you don't know in a few sessions, at least of where are we at and what's the work, there's a problem.
Sure.
That's just, every therapist has their own way of doing it, but we're super busy. We treat, anywhere between 150 to 200 pilots a month through our practice. So we want to really give you some tools that you can go out and deploy and see if that works, and then come back and we'll kind of tweak. And that's kind of how our process is.
Yeah. Well, that is good. And so to that end, with, how busy you are and whatnot, what does it, so I know, we like sending folks to you guys because you get it when it comes to pilots and so on. What does it look like with respect to your relationship with the FAA? Obviously, I'm not trying to, say, hey, do you call it the federal air surgeon? But what's that look like?
The FAA there's a lot of changing of the guard that's happening. I mean, there's people coming, people going there. And so it's always changing. But the interactions that we have had with FAA aeromedical people, it's typically just in their psych division, has been quite favorable. I mean, we've worked with some specific psychiatrists, and I think that they respect the work that we do. And some of them have even said, look, we will certify this pilot as long as it's contingent that they continue to seek services, whether it's monthly or quarterly or twice a year or whatever, with the therapist that they're working at Lift Effect. So I think used to be you didn't even know who these people were at the FAA. It was sort of like the wizard behind the curtain. That's you don't know who they are, what they're doing, and I think that that's changed. Now we don't have a lot of interaction with the FAA people. They kind of tend to just do their thing. But again, our interactions has been pretty favorable, and I think the newest federal air surgeon has been progressive, not progressive enough in our opinion. But we're always trying to push the bounds of where they're at. I mean, I think there's still kind of a 1950s mentality. It's changing.
Sure.
They're making some changes, not fast enough.
Sure.
But I don't think the FAA is the enemy that they, the perceived enemy that they used to be.
Yeah, I don't think so either. And not to go off on a tangent on you, but we watched the Hulu special, Lie to Fly and all that stuff. And we've heard the complaints and so on. And I don't, from my perspective, I don't know that it's the process itself. It's just how the process is carried out based off of, I think, of probably understaffing. I think in my mind, it's all understaffing. If they had, 10 psychiatrists there working these cases and they were going lickety split, you probably wouldn't even hear about this in some capacities, because I think the process is set up now more so than ever than for success in this capacity. With the chief psychiatrist, Dr. Flynn, who's no longer at the FAA, I think he did a lot to try to help move things forward from some perspectives. And, Dr. Bergdorf is there now, and, I think the same thing. So in that capacity, I think there's been a lot of people there trying to make changes, which I think is good.
I agree. I don't think it's the people. I don't have a problem with the people.
Yeah.
I have a problem with the system.
Sure.
And I have a problem with the way that the aeromedical standards are determined.
Yeah.
That's where I have a huge problem. And and honestly, not to get all tangential, but what the hell?
Yeah.
They still operate on this idea that a pilot with a mental health problem is public enemy number one.
Right.
And that's like this idea that, okay, if you're a pilot, you are too dangerous, that you're depressed and you're anxious and you are going to go crash a plane. Like, it's just not founded in any sort of solid science.
Right.
And I'll tell you, like, there's pilots that are flying depressed and anxious every single day.
Sure.
And they're not crashing airplanes. They're just suffering.
Sure.
And because of this idea, like, oh my God, you have depression, it means you're going to go crash a plane. I mean, that's like the equivalent of saying, don't go to the hospital because you might get sepsis.
Sure.
It's like nobody would go to the hospital then.
Sure.
So it's kind of this ham-fisted approach, which has driven pilots to just go underground. I mean, if you have policies that drive people underground to not get help, maybe they're not very good policies. I mean, call me crazy.
Sure. Yeah. I mean, I think that's reasonable. 2 points on that. One thing that we say around the office here, probably in the more informal settings, that, if in theory, I think if somebody was really going to use an aircraft to commit a heinous act, and suicidal, I don't think typically they're going to wait for their medical certificate or care what their medical certification status is. In a lot of cases. I mean, I don't see how that is really relevant. And then beyond that, to your point on how the regulations are interpreted, I think definitely that's an issue, especially when it comes to substance use related issues. We'll see frequently cases where I think the substance dependent standard is really sort of overused.
Oh my. Yeah, it's outside of the standards set forth by the American Medical Association.
Yeah,
which is egregious. Like it's like saying, I know this is what the AMA determines as a substance. We're going to make it tighter.
Yeah,
and say you have a problem. Like that's like, can you imagine operating like if you were just like ran a law practice like that?
Right.
Or if,
yeah,
like, that's crazy. Like, well, I know the law says, but we're going to just make it worse.
Sure,
or make it more stringent. Like, to me, it's egregious. And again, it's not the people, it's not the individual people.
Right.
It's the system that's just very broken.
Right.
And it's they're making changes that I just, but when you talk to sick people people that are suffering like we do all day, it's not changing fast enough.
Sure.
To be honest with you.
I agree. Yeah.
So,
well, let me ask you on that point. We like sending folks to you because, again, you have this understanding of what the FAA is looking for, what's going to help a pilot to pilot. Some people, though, aren't going to have that effort to reach out to you, and they may go with a local, source. What would you recommend to individuals who may go a local route, go to a local therapist? Is there something that you would recommend people look for in that capacity?
That's a really good question. I mean, look, the reason I started Lift Effect and we built Lift Effect into what it is to solve the problem of trying to find somebody good in your area. One of the problems a lot of pilots run into, I just actually talked to somebody today, is that once a therapist finds out they're a pilot and that especially if there's a disability paperwork kind of stuff that goes on, the therapist gets worried and goes, I don't feel comfortable working with you because I don't want to screw up your career.
Sure.
So one is, I think, finding a therapist that either has prior experience working with pilots and understands the FAA, which is pretty slim.
Sure.
But you might find somebody, and if they don't have the experience, are they willing to learn and do some research and get some guidance on how to work with pilots in the FAA?
Sure.
And unfortunately, a lot of therapists are pretty lazy. I'm just not trying to trash my profession. I guess it's any profession, right? I mean, and a lot of attorneys are lazy and aren't that great.
Yeah.
I mean,
some around here.
This is why we send people to you guys, though, because it's like you're willing to learn and keep up on what is the latest. And you guys are going to go actually find those answers if something isn't making sense. So you got to make sure that they have a willingness to like, okay, you're a pilot. There's this entity called the FAA. Well, what are the expectations and what do they need to know?
Yeah.
That's what I would be looking for. So prior experience working with pilots in the FAA. And if not, are they willing to actually do a little bit of work above and beyond just treating you to make sure that they understand what are the requirements of what's being asked of them. Now, again, it's not the therapist's job to know what the requirements are.
Right.
But the reality is if they don't know, they could inadvertently kind of make things a lot harder where they're very well intentioned, but they don't understand what is required to successfully treat the pilot, document, submit the required things. Those are really the biggest issues.
Sure. Yeah.
That's what I would suggest.
I think that's a good assessment for sure. And I think to that point, and I think kind of along those same lines, if somebody were kind of in need of therapy, but they were afraid to start it because they're afraid they're going to lose their medical or get deferred, what would you, I'm sure those recommendations are, finding the right therapist and so on, but are there any particular thoughts you have for those folks to encourage them to get the help they need?
I tell everybody, at the end of the day, I don't think that the FAA is the big bad wolf that they used to be.
Right.
With that said, they have a job to do. They have their standards. You've got to work within those standards. But if you're not well, if you're not healthy, this isn't going to go well for you. Mm-hmm. Not just in terms of your flying career, in terms of your life.
Right.
And so if you don't have your health, you kind of don't have anything, honestly.
Sure.
And, you want to get help before small problems just fester and now become really, really big problems.
Sure.
And so it kind of behooves you to just choose yourself first, because the greatest asset that you have in your life is not the letters behind your name. It's not your epaulets. It's not your bank account. It's not all the crap that you own, pilots, their snowmobiles and boats and all that. Right? It's not that. It's you. You're the greatest asset that you have in your life. And so if you don't take care of you, all that other stuff just doesn't mean anything.
Sure.
And so it's kind of that come to Jesus talk of look, I tell guys that call and gals, it's like, look, you're talking to me. There's there's a problem.
Right.
And it's either A, let's roll up our sleeves and do some work. We know how to help you get back. That's what we do. Let us worry about that, and let Anthony and his guys worry about the legal. That's what they do. All you got to do is help, just start to fix yourself. You have that option. Or B, don't do anything and stay in the hell that you're in.
Yeah.
Which one do you want?
Right. Yeah. And I always try to encourage people in that same vein is to say, it may take time, sure. And it'd be frustrating, but most of the time you're going to get through it. And, I think you'll come out better off on the other end for sure.
100%.
Getting the help you need. Well, Matt, if somebody were to try to contact Lift Effect or try to get in touch with you to get started with you, how would they do that?
So when they go to our website, there's all sorts of little buttons all over it that says, book a consultation call. And what that does is it allows you to book a completely confidential call. And I can tell you that, I do probably 90% of the consultations. I do most all of them. Mm. Everybody that comes through Lift Effect talks to me. Almost everybody.
That's good.
Unless I'm out sick. Yeah. Well, look, I want to know everybody that comes through. And then, whether they work with me or one of the other clinicians sort of depends on what their issue is and availability and all that stuff. But you book that call. It is totally confidential. Because we are mental health professionals, we actually have these things called HIPAA law, which protects the confidentiality of that conversation. So we don't have reporting requirements to the FAA or to the union or to anybody because of the law. So you can tell us all, you can tell everything that's going on, and it's safe, and then we will figure out what the next step is for you. And so you just go to the website, you click on that button, you put in your name and your phone number, you pick a time that's going to work for you, and then we will call you and we'll have a quick discussion where you can kind of give us the skinny on what's going on. And then we'll figure out if we're the right place to help you. And if we're not, we'll figure out where you need to go to start moving you in the right direction. So that's I think what scares a lot of people is they're like, oh my God, are they going to tell the FAA? Or it's like, no, we're not, because there's laws that prevent that from happening.
Right. Well, I think your Lift Effect's a great resource for folks, and I appreciate you being on with us today, Matt. Getting classing the place up here a little bit, but
yeah, right, man. That's you guys got a low bar if you're asking for me to class the place up.
Yeah. Well,
you've not been here before.
Pretty low, yeah. Wait, man, we really appreciate you being on, and we hope people get connected with you.
I hope so too. And I appreciate all the work that you guys do. I know we've got a lot of clients that have or are working with you. And I'm sure you guys have the same experience. If you just do your diligence and you're patient and you take the time and you actually just do the right thing and help yourself get the help you need, there's usually a path back.
Yeah.
There really is a path back.
Absolutely.
So, well, I appreciate you guys.
Yeah. Well, thanks so much, Matt. And we'll see you on the other side.
Indeed you will.
All right.
Talk to you later, guys.
Thanks,
have a good one.
Day.
Take care.
You too.
Bye.
Bye-bye.
All right. Well, that pretty much wraps things up. Alex, do you have any interesting little quips?
I think it's kind of cool that they have, a service like this.
Use your words.
I'm trying to get them out.
I bet you'd like to have a service that does therapy just for chiropractic.
Yeah. I mean, with some of the people that you have to deal with on that side of things, absolutely.
Yeah. Well, you've actually logged, I think, an eventful half hour plus listening to the Pilot Lawyer podcast as we doff our cap to Matt McNeil of the Lift Effect, thanking him for his time today. That's it for us. Have a good day and see you later.
Toodles.
This is the podcastfactory.com.